This video has been provided by the Home Infusion CLABSI Prevention Collaborative. Thank you in advance for watching this video. This video shows a patient and a caregiver, such as a family member, friend, or neighbor, working together. You have an IV line in you that you need to take care of at home. This line may be in your arm, such as a PICC line or midline, or your chest, such as a tunneled central line, or a port with a needleless connector. One of the hardest things for people with an IV line at home is to figure out how to bathe. It is really important that the IV line dressing remains dry. If the dressing gets wet, loose, soiled, or damaged, this puts you at risk for infection. The first way to prevent the line from getting wet is to keep the IV line out of the water. If you use a bath, never put your IV line under water, especially not the part that goes into your skin. If you are taking a shower, point the shower head away from the IV line. This may be easier if the shower head is detachable. The most important way to keep the IV line dressing from getting wet is to cover the IV line. You may need a caregiver to help you, as it can be hard to cover the IV line without help. If you have a PICC line or midline that goes into your arm, there are a few ways to keep the dressing dry. One option is to use a cling wrap product to wrap the IV line completely prior to bathing. This product is clear and stretches, but is slightly sticky so it can cling to your skin and to itself. You can buy it at any grocery store. Some get a special type of tape from their nurse to tape the edges. Others use a rubber band on either end. A second option is to get a plastic bag that is long and narrow. An example might be a bag at a store or hospital entrance to hold a wet umbrella to keep it from dripping on the floor. Do not use something that could have been contaminated with food or dirt. There are also some plastic bags available that have a glove at the end and go up to the shoulder. This is a great choice for a lot of people. With any of these options, be sure to tape and then use rubber bands to seal the top. If you have an IV line that goes into your arm, you can also buy a PICC line shower cover online from online stores. It goes over the area where the IV line goes into the skin and is held in place on either end. These can be reused for as long as a few months. If you have a tunneled catheter, port, or other device that goes into your chest, one option is to use the cling wrap we just described. It may help to have a caregiver cover the area of your chest or neck, and you may need to cut the cling wrap so that it fits well. Here, also, you can potentially use a special type of tape that you can get from your nurse to tape the edges. If you have medications being delivered on a pump, you can time your showers for a time when you are changing the medication, such as every 24 or 48 hours if this is how frequently you change the medication. If you don't change the medication this frequently, you could put a hook in your shower, hang a plastic bag from the hook, and place the pump in this. Keep the pump from getting wet. If you need any assistance, please contact your home health nurse.